Hi everyone, it's me, Melanie, your IVF nurse. And this post is going to be specifically about mixing your IVF medications. Anytime you have a powder vial, you're going to have a vial that is sterile diluent. So this is just like sterile water. These caps, they do flip off. So once you flip your caps off, they will look like this. And literally it just flips off like that. When you pick up your medications and your supplies, so your needles, syringes, alcohol swabs will come in a box that looks like this, okay? You'll also have a small box that will say Q caps on it. And your Q cap box will look like this. So these boxes, so your Q caps, it says it's got 12 Q caps in it, and your other box with your supplies will have 12 needles, 12 syringes, alcohol swabs, everything you need for the average stimulation. So if you're finding that your cycle goes longer than 12 days, or if you've made a mistake and you've had to open up more needles than you anticipated, do get more supplies from your clinic. When you open up the box of Q caps, it's going to look like this. So you'll have 12 Q caps and each one will be individually wrapped. Your box of supplies, when you open this, and I always struggle a little bit, when you open it up, you will see that you've got medical waste bag, syringes, you've got your alcohol swabs right here, and then if you dig a little bit deeper, it's here. So that's what you're using for your injection into you. Now, one of my favorite tools that's in this box as well is this little handy placemat. Sorry for all the wobbling around. And this here is just a placemat that I think that every patient should use initially when they're starting out their meds. So what's going to happen is it just helps you to get organized. So it says one syringe and it says one syringe on the packaging. You're going to put that there. You're going to take your needle for the injection. That's your needle for your injection, the 27 gauge needle, and that is your injection needle. You're going to take your vial of diluent, and you're going to take your vial of Menopur, Repronex, or maybe even possibly Bravelle swab. And then you also need a Q cap. So you're going to open your box and grab your Q cap and place that there. So that's everything you're going to need for your setup to do your mixing of your Menopur or Repronex or Bravelle and do your subcutaneous injection. What you're going to do is start by taking your syringe, and you do want to use a new needle and syringe every time you're doing a shot. So what we'll do is just start by opening this syringe from the packaging, and you're going to take your Q cap, open that up, and then you're going to take the Q cap and screw the Q cap on. Manufacturer says that if you're mixing Bravelle, Repronex, or Menopur, you can mix up to 6 powder vials with 1 cc of the diluent. So what we're going to do is take this Q cap that's already on the syringe, and we're going to place it on the vial. I've already flipped off the caps. I want to show you something that happens in the event that you forget to pull back the syringe to put air in your vial of diluent. What happens is that there is a vacuum seal in these vials. So when you flip that cap off, if you do not pull back on the plunger of your syringe, and you just go ahead and hold this on a flat surface, holding your syringe by the body of the syringe, you push down, it fits snug right over top of the vial. You're going to take out 1 cc of water just by pulling and then down to the 1. Now, if I let go of the plunger, because I'm holding it right there, as you can see, if I let go, you're going to see that it slowly pulls the plunger back up because of the vacuum seal in the vial of diluent. If you forget to add the air first, and I'm going to show you how to do that, you're going to just want to make sure that if you've put the syringe with the Q cap on and you're withdrawing your 1 cc of diluent, you want to make sure that you hold it like that. The easy way to take this off from the Q cap is bend it to the side and it literally pops right off. Once you've got your 1 cc of water, then you're going to go into your powder vial, okay? I'm going to get to that. I just want to show you what's going to happen. If we were starting all over from scratch, let's say, you flip off the cap that's on the vial of diluent. You're going to then take your syringe with your Q cap on it, pull back the plunger to the 1 cc. So you've got air in your syringe here. You're going to take your syringe with your Q cap and you're going to put it on the vial. So on a flat surface, and you want to hold your syringe by the body of the syringe, pushing it down so it fits snug right over top of the vial. You're going to inject the air into that vial of diluent or the sterile water, turn it straight upside down, and you're going to pull out down to the 1 cc. And you will see that if I let go of the plunger, because I've broken that vacuum seal, it's not going to pull the plunger back up. So it makes it a little bit easier if you remember to break the vacuum seal by adding air first. Once you've got your 1 cc of diluent in your syringe, like I said, the easy way to remove these vials is just to bend it to the side and it literally just pops right off. Once you have your 1 cc of sterile water or diluent in your syringe, you do keep the Q cap on. You're going to put this sterile diluent into your powder vial. You want to hold your powder vial on a flat surface, just because I've seen when people go to do this, sometimes they do that, and if you're mixing multiple vials of powder, it's just going to be a big mess. So hold it on a flat surface. You're going to take your syringe by the body of the syringe with your sterile diluent in and your Q cap still on. You're going to push that down right over top. It fits snug on top of the vial. And then you're going to inject the sterile diluent or the water into the powder. Now, what happens is that the powder that's in the vial dissolves as soon as the smallest drop hits it. So don't be worried if you inject the water in and you see no powder, because it does dissolve really quickly. If in the chance that you do see when you're looking at it that there is white particles floating around, just let it sit maybe for like another 10 seconds. Take a look. If it's clear, you're going to take everything out. If it's not clear and there's still white particles floating around, what you can do, go like this just to kind of speed it along. Do not shake it like this, because it's going to make a whole bunch of bubbles. Once you've got everything dissolved, you're going to turn your syringe and your vial that you've dissolved upside down. You're going to take everything out. So if you're putting in 1 cc of diluent into the powder vial, you're taking everything out, because your medication is, if it's 75 units, you want to dissolve the entire 75 units and take everything out if it's 75 units. Once you've got everything out, and I always recommend pulling back till you see a little bit of air, because what happens is when you look really closely, and I don't know if you'll be able to see it this way, but I've got a little bit of air in my syringe right here. And if you look closely, you might see that there still looks like there's some liquid in there. But the way that this is designed, it's not going to let me take out every last drop, and that's okay. What you're going to do once you've got back a little bit of air, because that's going to mean that there's nothing else that's going to let you take from this vial, you're going to bend this to the side, pop it off. This can go into your medical waste. Unscrew your Q cap, and then you're going to take your needle for your injection, and it's a new needle every time. This just screws on, and I always recommend that when you're screwing on the needles, you want to hear this kind of squeaking noise to know the needle is on securely. Once you've got your needle on, you can give it a few flicks or a few stubborn bubbles. Remove the cap, and then you're just going to gently push up on the plunger until you see a bubble at the tip. Okay, and you should have, if you look, let me see, right there, that's at the 1. There's the half, there's the 1, there's the 1.5. So that's your 1 cc, which is equivalent to your 75 units of either the Bravelle Repronex, or Menopur. Once you're set like this, then you're good to go to do the injection. And you'd follow the technique for subcutaneous injection because your needle is small. When you've completed this injection, what you're going to do is, if you've got your cap here, you never want to recap it. I've seen it where people try and recap and the needle actually goes through the cap and they poke themselves. And the other thing is that you don't want to put this into your medical waste bag without capping it, because the medical waste bag is plastic, and I've literally seen, if you can see that, the needle goes through. So I've seen people that come in to the clinic and they have this in their purse and their needles are not capped, and they pull this out of their purse, needles are sticking through, and they poke themselves. So you do want to recap your needles when you go and put them in your disposal, unless you've got one of those larger yellow medical disposal waste kits that you can put everything in once you've completed your injection. In the event that you do not have that and you are using this plastic medical waste bag, you're going to just put this on a surface, a flat surface, and you really don't want to touch anything. You're going to take your needle and your syringe, you're going to go like you're trying to do it with one hand, just like that. Got the cap on, and then you're just going to do that, and it's literally recapped, and you haven't done anything to poke yourself, okay? And then you can either unscrew the needle and only put the needle into your medical waste bag. You can put the entire needle, it actually fits into the medical waste bag like that, and then you want to seal it. And then when you're going into the office that you're doing your IVF treatment at, they should have a medical disposal container that you can empty this either in the lab, or you'd ask one of the nurses where you could dispose of this. Most times they'll say do this at the end of the cycle unless your bag is full. In the event that you are mixing more than one powder vial of the Menopur or Repronex or Bravelle, you would use the same tool like this, and you would put out one syringe, one injection needle, a Q cap, your alcohol swab, your one vial of diluent. But keep in mind that every vial of diluent is going to accompany the vial of powder. So you'll have a ton of diluent vials that you're not even going to need. So you can always return those back to your clinic. A lot of the times the nurses will use them in demonstration to patients when they're learning how to use their medications. And then you're gonna line up however many vials of powder, so Bravelle, Repronex, or Menopur, dilute it with your powder vials. What you're gonna do though is that you have your syringe and you've got your Q cap on. You take out your 1 cc of water, just like that. Take everything out, bend it to the side, it pops off, okay? You can remove the air a little bit. You're gonna go into, say you're mixing 2, you're gonna go into the first powder vial. That fits snug right over top, inject the water, turn it upside down, make sure it's completely clear, pull everything out, bend it to the side, it pops off. You're then going to take the second powder vial. So the first one you can get rid of. Take the second powder vial and you're going to do the same thing. So holding it by the body of the syringe, the Q cap's going to fit snug right over top of the vial. You've already diluted the first powder vial in here, so you've already got 75 units in this. You're going to push that down into the powder vial here. Now you've got 150 units that is dissolved into this vial. We need to take this out. Turn it upside down, take everything out. So until you see air, same kind of routine happens here, where pull back till you see a little bit of air. If you're looking here, you may be able to see that there's little bits left in there. It's not going to let you take it out. Usually when your needle and syringe is completely straight, upright, if you're pulling back from a vial, if you start to get air back, it means this one's empty. Bend it to the side, it pops off. Unscrew your Q cap. You're going to screw your needle on until you hear that squeak. And then make sure you take out any air bubbles that you have. And then just gently push up until you see a bubble at the tip. And then you've got your 2 powder vials, so 150 units in your syringe and you're ready to inject. I hope I wasn't too quick in going through all of this with you, and I do hope that this helps you as you begin your injections, or if you're continuing and you're midway through and you just needed another reference to make sure you're doing it okay. Find that when you're mixing more than one vial, Menopur, Repronex, and Bravelle, I've heard across the board with some women that when you're injecting this medication, it does cause stinging and burning. If that's the case, then you can go either as fast or as slow during the actual injection. So if you find that pushing the plunger as you're injecting the medication into you, going slowly is better, then you can do that, as long as you're making sure that you get the entire medication that's in the syringe injected into you. If you decide that, you know, you just want to hurry up and get that injection done with, you do your shot, push this as fast as you can. It's only going to let you go so fast anyway. You're going to push that to inject the medication into you. Once you're done, you pull out. If you're going to press gently just to minimize any potential for large bruising. And then the other thing is that with the Menopur and Repronex and Bravelle, it's very normal that your injection sites will get, possibly, because some people are fine with it and some people are extra sensitive. So it is very normal that you get red or itchy at the injection sites. And your injection sites are usually abdominal or on the outer thigh. So if you're finding that the current sites that you are doing your subcutaneous injections in, you can always look for references in terms of alternate sites to do your subcutaneous shot. Ideally, where you want to do it, most people associate the abdomen with being closer to the ovaries. So many patients that I've seen over the years will only do it in the stomach. You want to make sure that when you are doing your injection around or in the stomach, that you're not going too close to the belly button. So 2 to 3 fingers on either side of the belly button. It is important that you rotate your sites. People will find that if they are wearing their pants and it rubs along where they've done the injections, that can cause irritation. So you want to watch where you're doing your injections. Some people, they don't care. So it's entirely up to you, your own personal preference. If you're doing the outer portion of your thigh, you want to make sure that you are also rotating your sites as well. Usually I don't recommend doing it in your arm, only because if you do, after a while when you're doing your injections in your tummy or your thigh, you realize how sore it is. So it may actually start to feel like when you get your flu shot and your whole arm starts to get sore. So I never really recommend doing it in your arm. Most people will do their injections into their tummy, and once again, you do want to make sure that you rotate your sites just so that you're not constantly feeling that tenderness in that one specific spot, because after a few days it's going to feel like someone kicked you in your stomach. Anyway, I do hope you found this useful and helpful. Please feel free to email me at yourivfnurse@gmail.com, or feel free to check out my webpage, www.yourivfnurse.com. If you like my video, feel free to subscribe and comment down below. Thanks for watching.